Hello. Today we will be discussing how to handle different types of bleeds in the classroom settings. We will cover minor bleeding, major bleeding, and nosebleeds. First, we will look at Allison P's policy for medical emergencies. If you think the situation is serious or you are unsure of how serious it is, you should check the scene for safety, check the student for consciousness, and then call EMS. You should call 911 or use the phone numbers listed below. You should be prepared to tell the dispatcher your name and number, your exact location, the extent of the situation, how many people are involved, and a location for someone to meet the ambulance. Do not attempt to provide any type of care that you are not trained or certified to do. First is a minor bleed. Some examples of this could be a paper cut or a scraped knee. You should get the first aid kit in the classroom if that is available. You should put on gloves if you have them to avoid touching the blood. If not, have the victim hold pressure on the wound if they are able. You then need to wash the cut with soap and water with a clean towel or piece of gauze. You will then hold pressure on the cut for 2 full minutes to stop the bleeding. After 2 minutes, you will check to see if they have stopped bleeding and apply a clean Band-Aid or a piece of gauze. The important part to remember is that no matter what resources you may have a lot, you may have none, is that you hold pressure on the wound. And you'll do this, a minor bleed, for 2 minutes. Next is a major bleed, which can result in significant blood loss. The wound will be deep, heavily bleeding, and may be hard to stop. This could be a result of a puncture wound or some type of trauma. First, you want to call for help. If you have any resources like gloves, put them on to avoid contamination. You want to lie this person down to prevent further injury in case they become lightheaded or faint. You do not want to wash this wound because it could wash away any clotting that has already occurred. Hold firm pressure with anything that you can use, towel, t-shirt, gauze, anything. If the dressing becomes saturated, do not remove it. Just add more on top because you do not want to remove any of the clots. Hold firm pressure for a full 5 minutes or until emergency personnel arrives. While you are waiting on EMS, continue checking on the student because if they become cold or extremely dizzy, they may go into shock from blood loss. A few more tips worth mentioning on major bleeding is that if it is a puncture wound, you do not want to remove the object as this could worsen the condition of the student. Do not attempt to pick out any debris that may be in the wound because it could worsen the bleed. Do not use a tourniquet to try to stop the bleeding. Placing the tourniquet too tight can put the student at risk for further issues and tissue damage. A tourniquet should only be used by trained personnel. Stay with the victim and hold firm, consistent pressure until help arrives. Lastly, we will talk about how to deal with the nosebleed. These are common and could be caused from a fall or just from seasonal allergies. Again, put on gloves if you have them, and if not, have the student hold the towel to their nose. You want the student to sit up and lean forward. You do not want them to tilt their head back because they will continuously swallow the blood. You will pinch the soft part of the nose and press against the bones of the face to stop the bleeding. Hold pressure on the nose for 5 full minutes and do not check to see if it is stopped. A few more tips for a nosebleed. If you have a cold pack, place this on the nose and cheeks because this will constrict the blood vessels and slow the bleeding. Instruct the student to not blow their nose or rub their nose as this could prolong the bleeding. After 5 full minutes, slowly release the pressure. If it has not stopped, reapply pressure for longer than 5 minutes. If a nosebleed lasts more than 15 minutes, you should call 911 for help. Here is a good example of a minor bleed. You can see how this bleed is contained and how we do wash this with soap and water. Now, this bleed, on the other hand, is a major bleed. This is a gunshot wound, and even though the person doesn't have or is not using anything to hold pressure, they are using one of their fingers. Also, they're not trying to get the bullet out. you want to wait for medical personnel to help with that. And then we have this graphic showing the correct way and the incorrect way for a nosebleed. A lot of people have been taught the incorrect way, but the correct way is actually to pinch your nose and lean forward instead of backward because you could potentially swallow that blood, which could cause you to aspirate. And aspirate means fluid or food going down your airway, and that can cause an obstruction. And this obstruction could be very serious. Sometimes there could be bleeding that is internal and that you cannot see. The signs and symptoms that suggest internal bleeding are pain at the injured site, a swollen, tight abdomen, nausea and vomiting, pale, clammy, sweaty skin, breathlessness, extreme thirst, and unconsciousness. Internal bleeding most often happens from a trauma. This is why it is very important that if you witness or at the scene of a trauma, you call 911 for help. The first thing to note for internal bleeding is that it is a medical emergency. First aid cannot treat or manage any type of internal bleeding, and you must call 911 for help when you notice this or suspect it. What you are going to want to do is lie the person down. Then you are going to cover them with a blanket to keep them warm. If it is possible, you're going to raise their legs above the level of their heart. Do not give them anything to eat or drink. This person is probably scared, so offering them reassurance and hope will be great. The most important thing is that you stay with them until help arrives. You may not have these, but if you do, it is very important that you wear these. Infections and diseases can be spread through open wounds. Before administering any type of care or first aid, if you can, try to wash your hands first with soap and water. Then dry your hands thoroughly before applying on gloves. Yes, we want to help the injured person, but you must also make sure that you are staying safe and taking care of yourself. Now that we've gotten through all the content, it's time for some fun facts. Some fun facts about blood is that it only takes 20 to 60 seconds for a drop of blood to travel from the heart through your body and back to your heart again. Cows have 800 blood types. In humans, O positive is the most common blood type. However, O negative blood is the universal blood type because anyone can receive it no matter their blood type. Another fun fact is that all blood isn't red. Crabs have blue blood, earthworms and leeches have green blood, and starfish has clear or a yellowish blood. A red blood cell is about 7 microns in size. For reference, a micron is 1/1,000,000th of a meter. Once help arrives and you're all settled down, this could have either been a smooth situation or something that was really traumatic for you. In situations like these, it is very important that you debrief and talk to someone. On campus, we have Boyd Health Services, which is health and counseling in the Art Building. Health and Counseling offers 12 free counseling sessions to talk about anything that you would like to. Their information is listed here. This information is for you just in case anything like this happens so that you are prepared and equipped and that you know that you can do it. Again, thank you for watching this video on classroom emergencies. Bye-bye.